Hi everyone, I am back with a new video. This time we're going to talk about hearing problems that we cover in adult, but if you're looking for the vision problems video, it's in another one, okay? So just search that YouTube channel. All right, so let's see what hearing problems we're responsible in adult for. So the first issue is otosclerosis. And otosclerosis is sort of this abnormal bone growth that happens inside the ear, in the middle ear, that causes hearing loss. And this happens usually in young adults or sort of adolescents, young people. It's the most common cause of hearing loss. It's hereditary and it happens bilaterally in both ears. The important thing about this bone growth is that within this bone, in the middle of the ear, is where sound conduction happens. And this little bone that we have that is called the stapes bone vibrates. And when it vibrates, sound conduction happens. And we need that in order to hear. However, when the bone overgrows, that vibration doesn't happen. It almost makes it kind of stay still. And so that's when we come into problems. We can treat it with hearing aids, but that's only temporarily. As the bone grows, people start losing the hearing ability. And so eventually they're going to need a surgery called stapedectomy. Now, before I get into stapedectomy, let me tell you about this drug therapy that it's oral that we can take or patients can take with sodium fluoride with vitamin D and calcium carbonate. And basically, what it does is that it decreases bone resorption. And so it doesn't allow the osteoclast to eat the bone so that way it starts generating. So, in a way, it almost slows the bone growth a little bit, but it's just temporarily, it's just to slow the progression of the issue, not to fix it. In order to fix it, we need this surgery called stapedectomy. Now, what this does is that they remove the bone that is overgrown and they put this metal prosthesis or artifact in place of it. And that way now the vibration happens. So it's almost like take out the bone and put a prosthesis that is metal, then now it's going to function and bone is not going to grow around it. Usually it's done under conscious sedation. Um, Now, after the surgery, people have a lot of inflammation and accumulation of blood and fluid within the middle ear. So patients initially experience hearing loss immediately after. Um, well, let me back it up. They hearing is better immediately, but afterwards, the inflammation and the buildup of fluid can cause hearing to decrease. And then once this kind of subsides, it makes it better. The hearing is better again. So it almost gets immediately better. Then, boom, inflammation and fluid accumulates. You get decreased hearing, and then it gets better over time. They usually just put a cotton ball in the ear in a dressing. Patients may experience nausea, vomiting, dizziness um, due to the inflammation and the blood fluid accumulation. They could also have something called stigmagnus, which is this kind of very uncontrolled, repetitive eye movement. And they could also have vertigo. Therefore, it's important to teach our clients to not make any sudden movements with their head or just sudden movements overall, because it can lead to vertigo. Also, nothing that increases pressure within the ear, like coughing, sneezing, again, pinching your nose and kind of blowing, lifting, bending, bearing down, like if you're constipated, all of that can increase ear pressure. And so that's otosclerosis. Pretty much, again, is hereditary. It happens in both ears. It's the leading cause of hearing loss in young people, and we can fix it by a surgery that basically takes out that overgrowth of bone and replaces it with a metal prosthesis. The next is Meniere's disease. Meniere's disease is sort of a progressive disorder. I kind of like to call it the heart failure, congestive heart failure of the ear, because it accumulates fluid within. And then that accumulation of fluid can exacerbate, can get better, and then you might have your bad days. And when we have fluid built up in the ear, it leads to all these symptoms of hearing and balance problems, nausea, vomiting, vertigo, also ringing at the ear, and almost like the patients are like spinning in one place, which can lead to a lot of safety issues like fall risk. So the treatment for this is corticosteroids, antihistamines to dry up the fluid, anticholinergics like atropine. Again, it dries up the fluid. Nausea medication and anti-vertigo medication. So we're sort of treating the symptoms, but also trying to dry up the fluid. You want to promote some rest. You want to have a diet low in sodium and stress-free. The low sodium diet helps with fluid being built up as well. You want to avoid swimming, being in high places like ladders, because you can get dizzy and then fall. To diagnose Meniere's, we can diagnose it with 2 or more spontaneous episodes of vertigo or dizziness. We can do vestibular tests, which is basically this series of tests that determine if what kind of is causing the vertigo. Or you can have this glycerol test, and your book talks about these in page 386. This glycerol test basically is a almost like a hypertonic solution. And so once it's put it into the ear, it almost sucks the fluid within. And so if the client hearing improves, we know that they have Meniere's disease. They have that extra fluid accumulation. And so and the product that they put is glycerol. That's why the test is called glycerol test. Anyways, that's Meniere. So basically, we're dealing with an extra accumulation of fluid in the ear that can exacerbate, can get better, can get worse. It causes a lot of issues: nausea, vomiting, vertigo, tinnitus, ringing in the ear, balance issues, as well as hearing issues. And we can treat it with medications that dry up the fluid, or almost like the symptoms, like nausea or vertigo medications. Think about safety, just not being in high places, because the vertigo is for real, and you don't want to fall or anything. Okay, moving on to the next one. The next one is benign paroxysmal positional vertigo. That's a mouthful. We've abbreviated as BPPV, or just simply positional vertigo. And this problem happens, and this is in page 387 of your book. I always tell you your book. This problem happens because we have these little things. They're like little crystals or rocks that can flow in the ear. They're in a special place, and I'll show it to you in just a minute. And they're in this special place in the ear. But when they get out of that special place, then they start floating around almost like debris, and that is what causes it. So it is the most common type of vertigo. You're basically spinning all the time. Um, it can occur when you move your head in a certain position, like if you're laying in bed and you're changing position and turning from left to right, or also going from sitting to standing position. The symptoms are nystagmus, and again, that repetitive, uncontrolled movements of the eye, vertigo, dizziness, loss of balance, and nausea. So if the symptoms are very similar to Meniere's, but here we're not dealing with fluid, we're dealing with these debris or rocks, crystals that we have inside the ear. Um, we treated medications can improve the symptoms, and some of the medications that we use are antihistamines, anticholinergics, and hypnotic sedatives. But almost a procedure that we do is called Epley maneuver. And so here are the crystals. So if you notice, they're right there in the middle, and then if they travel, it starts causing issues. They're in those canals. And the Epley maneuver, basically, they lay the patient down in a table and they just kind of start spinning the head in different directions. So that way we can, in the hopes that they can reposition those crystals or that debris rocks back to the place. Sometimes it works, sometimes they need a few of these sections. And so, but most of the times it works. Okay, so that's benign paroxysmal positional vertigo. It has to do with rocks that are out of place. It creates a lot of vertigo, safety concerns. The choice here is either Epley maneuver or antihistamines or anticholinergics. Again, my references are from the book, and my images are from Google or the book. I'll see you in the next video. Bye-bye.